Here.
Yeah, so it's just been kind of an adventure. Being on surgery is definitely unique. I don't think I personally am interested in that as a field full time, but surgery as a whole is very interesting. And I've been on trauma at a level 1 trauma center here in Indianapolis, and so I've been able to see a lot of really unique pathology and a lot of clinical situations that you wouldn't always expect to see as a medical student in the hospital presenting, whether it be traumatic injuries or critical scenarios. A lot of that stuff we talk about in medical school, but you don't get a whole lot of exposure to until you get a little bit more advanced in your training. And so one of the major benefits to being in the surgery program I'm at is that I have been able to see some very unique situations. And one of the major reflections I have is just being able to bring some humanism into medicine is something as an osteopathic student I feel well equipped to do. So inside those scenarios, a lot of times there are so many professionals in the room. As a medical student, you end up being a little bit more of an observer as the learner and not so much an active participant because it is a life-threatening scenario. It is a critical scenario. But one advantage to being a DO student, I feel, is that I always come back to the root of what does the patient need right now, and how can I help with my current understanding and with my current skill level. And so oftentimes that's just jumping into the room, grabbing a blanket and making sure I'm covering the patient's modesty, or making sure they're warm, or making sure that they have a hand to hold. So many times on this last couple of weeks, I've just been there holding the patient's hand as the person who's constant as people are running in and out of the room, making sure that the patient is stabilized. And that's been something that brings me a lot of life, and I think is a major takeaway from some of the more critical scenarios I've seen. I've also been on other rotations where I've seen more outpatient medicine and inpatient medicine in a bit more stable setting, and humanism in medicine, basically looking out for the patient, seeing what their needs are instead of just the clinical side of things, but actually cognitively, emotionally, spiritually, kind of the triad of of body, mind, and spirit, kind of interconnecting those in the best way I can as a third-year medical student has been very unique, and I have found a lot of life in it.
It's awesome.
Absolutely. Have you thought about what you want to practice what your specialty is?
I have. Yeah, I'm really interested in family medicine right now. And I see Dr. Wagner smiling. She's actually my advisor, and we've had a lot of conversations about this. But I really feel that through my training at Marion, I've developed a huge passion for longitudinal care, just seeing people get better long term, not just acutely, and really preventing them from having hospital visits. You know, in a trauma scenario, you can't necessarily prevent that scenario, but when you have somebody who has chronic disease processes or even acute on chronic disease processes, I think there is a very unique place for a compassionate team to come alongside. So that's really where I see myself in the future. And osteopathic manipulation is a huge passion of mine. And I think that within the outpatient realm, that fits very well. So Dr. Wagner has been very instrumental in that. As she said, she is as an OPP professor at Marion, learned a lot from her and a few other very talented professors at Marion. And that's something I definitely want to use in the future.
Excellent. Any of you second years have any other questions for Paul?
So sorry, my Wi-Fi completely cut me out. If it's anything I've learned from being on Zoom, I got kicked out, and it's common. I did have a question though, if it wasn't already answered. While on your rotation, are there other residents in the hospital that you're working at, or is this more of a medical student only? Because I've heard from both, and I was wondering how you felt about whether you are or not around residents, like your experiences there.
Yeah. So the hospital I'm at is actually has a surgery residency. So I am with resident surgeons, and that varies from intern level, straight out of medical school. They graduated in 2022 to 5th years that are getting ready to begin the application process for future jobs or fellowships. So a fairly wide array. And a couple of the days I've actually been able to be in surgery and to work one-on-one with the attending. So it's a pretty wide spectrum of who I'm working with. I think a huge advantage to that is the interns understand where we're at, quite honestly. You know, they were not here very long ago, 2 years ago for the intern level students in most cases, unless they did a prelim year, which is possible in surgery. Which for those of you who don't know, prelim year is like a intern year before you reach intern year at match. So it would kind of extend your training just a little more. So there's a few people who are in that position at the residency program as well. But all that said, the major advantage is there's always somebody there to answer a question. Sometimes when you're working with attendings, things are so fast paced, and I have had a few rotations where I'm working only with an attending where, you know, their workload is so heavy that taking time to answer a student's question can be a little, not necessarily their highest priority at all times of the day. You can totally ask questions, but there are times when you can and you can't ask questions. Versus when I'm working with an intern and a resident, a lot of those opportunities are a bit more frequent than when I've worked one-on-one with an attending. So that's kind of my takeaway from that. As far as like actually getting my hands on procedures, when you're working in a level 1 trauma situation, it is kind of critical. So a lot of times you don't get to do a whole lot of hands-on surgical procedures, but you do get to observe a lot of them. And I think that'd be whether I was at a residency or not, from what I have heard. In some outpatient surgical settings, I've heard some of my friends get to do just a little bit more, but for the most part, you're the observer in the operating room, and then you get to kind of participate a little bit more when you're rounding and seeing patients out of the operating room.
Thank you so much.
Also, an added level of complexity to my story is my wife is actually also a medical student here at Marion. So that's also kind of unique in my story. So I carry a couple of unique positions, I think.
Absolutely. Wow. That dynamic must be very interesting, I'll say. That's the word I'll choose. Interesting.
Yeah. It has its it has its definite benefits, having somebody alongside you that you know, intricately understands what you're going through. She's a year behind me, so she's in second year, like many of you guys are. But yeah, it's definitely a huge benefit. A major drawback is that you can never stop thinking of school, because if I'm not stressed about school, she usually is, and vice versa. But it's worked out really well for us.
That's wonderful.
I actually had a funny story when you mentioned like your wife was a medical student too. So one of my mentors, he's a cardiologist, and him and his wife both work in the same office. So she's actually the medical director and he is in charge of the research. So their offices are right next to each other, and every single day, and I worked for him for 3 summers, and every single day he would take his lunch, walk over to his wife's office, and they would sit and eat lunch all the time. And it was just so heartwarming to see how, like, you know, you can get caught in like the medicine and like the busyness of it all, but like they still found a way to like take a moment out of their life and like actually sit and talk to each other even in the hospital, which I was like, this is amazing.
Yeah,
That's so cool.
it is. That kind of leads me to one of the questions that I posed to you all earlier, is how do you all maintain the balance so that you have some semblance of normalcy in the rat race of med school?
Personally, well, my boyfriend, I live with him, and he's a cop in the city. So he is gone in the evenings. And so we don't see each other as often as we'd like. And that's really funny because we share the same bed. Most of the time he comes home and I wake up and like, oh, there's somebody there. But when it comes to maintaining balance, I think that I am a big planner and I like to plan ahead. So I always make sure when I make my weekly plan, I plan in some of those free times. And I also think the most important thing, and also something that drives me nuts, is I'll do a lot of extracurriculars, or maybe not a lot. I do a few extracurriculars that I do a lot in, but it is so important to base those off of what you like and not just for your resume. And if you're lucky, your resume is going to be kind of leading you towards where you want to go anyway. So hopefully they all blend together. So like I do research, or I shadow at a hospital. but these are things that I love to do. It's not an added task that I have to do. It's my fun time, my non-study free time. And I think that's really important to recognize, because I know a lot of people fill their schedules, which is fantastic, but as you were asking, it leaves no room for that fun free time. But we're all in medical school, we're all nerds, so sometimes that fun free time is majority things. So that's my take on it.
Thank you.
Well, I will tell you guys that it will be a lifelong practice to figure out what the balance is. And what I've learned over the years is that you can have it all, you just can't always have it all at the same time. And you just kind of, there'll be different phases in your life where other things will take more precedence. I had a long distance marriage for the first 5 years, and we moved apart while we did some education and training. And then we've been married 25 years, and different needs of family and kids. I'm actually doing this across the street at the library across from the high school, so I can run over and make my daughters play tonight. So you just find those little ways to make it all work. And sometimes you feel like you're a better doctor than you are a parent or a wife or husband. Every day is a little different, but
Right.
it all, in the long run, you just give your all to everybody as much as you can and make choices along the way of what needs to take precedence to time, and it all works out. But
Right.
it is a lifelong practice. So the more you can kind of get, things figured out now a little bit and keep working on it your whole life, but don't feel like it's ever just going to be balanced on its own. It's part of the fun of our career, is that it's a lifelong learning and lifelong excitement, and different things always happening in your life, and you figure it out.
Now that is a life lesson. Absolutely. I love that. You can have it all. You just can't have it all at one time, at the same time. That's beautiful.
I felt like she was talking to me by herself.
Yeah.
So thank you.
It took me a while to
Yeah.
accept and realize that, but it's true. It's like, yeah, we all have these expectations, like I could do it all. And well, yeah, but you do have to make choices along the way. Some things just take precedence at different times of your life, and you'll make those adjustments where you have to, and it all works out.
And that's such a great nugget for these young people to hear as they're entering this profession, that there is time for everything and it all works out in the end. And I think that kind of aligns still with that whole mind, body, spirit kind of connection that's unique to osteopathic medicine, right? Is it all has a plan. It all has a plan.
And
Well,
Regina,
I think-
it is a good nugget for these younger learners. But I'm happy she said it so that those that are of us who are graying around the edges would be reminded,
Right.
because I certainly need to be reminded.
Yeah, so we're all cut from the same cloth, whatever our career path is in higher education, and it's just always, we have to remind each other sometimes, I think, too. And
Yeah.
But again,
Because-
like I said, if you're passionate about what you do, it doesn't seem like work, right?
Yeah.
And while I've only been with AACOM for just a year, I am so passionate about the profession that I knew the least amount my entire life. I've learned so much in a year. And truly the mind, body, spirit concept of health and healing and wellness for patients, it just really resonates with me. So finding balance after a year is needed, but I am so passionate about the work that I do on behalf of the students.
Ditto.
And I think that's a good thing to drive home to applicants too, is understanding. And I think, fortunately, the allopathic programs have really become very much more holistic as well, which is great, and have kind of more humanistic side to their students and patient care. So I don't think that's something we want to be unique about. We want all med students and patients to benefit from that. But I do feel like osteopathic programs tend to take care of the students in a different way as well, and that the environments are smaller. I mean, Paul and I get to see each other and spend time together, even when he's off on rotations, because they come back and we're a small, tight-knit group of people. I think most osteopathic colleges are like that, the relationship between professors and students, but also just the wellness programs and the, really trying to foster what we expect for our patients within our own education and treatment of our students well. So I think it's a more palatable approach to learning medicine. I went to Michigan State, and I felt like it was a very cooperative and unique environment. And I see the same things in Marion too, that about learning together, and it doesn't feel quite as competitive, and it's more of a community-based experience. And I think that for the most part, most osteopathic colleges are that way, and students may find their educational experience to be a lot more tailored to what their needs are and what they want out of their medical education. So.
And that less competitive nature and more community learning was a similar sentiment that I heard from the two young ladies that was at the OMED conference at the gala. So
that's because we're mostly community-based type of
Right.
medical schools and not the higher level academic, which tends to be a little bit more competitive environment. So
good evening, Ava.
Hi, how are you?
I'm well. We're just here chit-chatting, waiting for our visitors to come.
Okay.
what year are you, Ava?
A second year. I should probably change that. Hold on.
I can definitely speak on the community base with osteopathic schools. I mean, when I had interviewed, my whole reason of choosing the school I chose was solely because of when I was at the interview, all the students that talked to you that kind of like, this is why we love this school. They were so close with not just the professors, but the admin and the deans. Like everybody just knows each other and they joke with each other. And, when you come from, I guess, like college in general, the deans, you've got to be stern and professional, but they would go, oh, hey, what's up, dean? Like, how are you today? Take a little hug, whatever it is. But that's like such a beautiful community. And like around different interviews, I saw the same thing at different schools. It's different in a great way.
Excellent. Anyone else want to share?
I could talk a little bit about like while we were all talking, there are a couple of us from AACOM, and I wanted to say that it's nice to hear and see that other people in other schools are literally experiencing what we're going through at the same time. So it just sort of reinforces that we're not alone. We're all going through this together. And like, yeah, it's different. And I don't know like where your schools are necessarily, like I see that you guys are like from Indiana and stuff like that, or like all over the country. And it just reinforces the idea that like we're all doing the same thing and we're all working towards the same goal. So I just wanted to like say like I appreciate that.
Is Nicole Wadsworth your dean?
Yes.
She is phenomenal. She's phenomenal. Yes. And Angela, your admissions, Dr. Wagner, your admissions people are just, they're something else.
They're really great.
I enjoy working with them.
Yeah. Ricky and Kyle have done an amazing job the past couple of years, kind of shifting gears and stuff.
Yeah. Kyle is one of the first admissions directors that I met. So yeah. Yeah. I need a board with pictures and faces to put the admissions directors with the deans. I'm trying to remember everybody. So
yeah, and I think I think we're really unique. I don't think anybody will ever top Chris Parr, who's our person for GME, but I think most osteopathic schools have a tremendous commitment to their students on matching and GME and support through that, which I think is probably fairly unique to our more community type environments that we have in osteopathic training. I can't say that for a fact, but my hunch is that connection with the students and that commitment to the students through that whole process, through the whole entire 4 years, and that longitudinal connection through the GME process, I think is kind of a good selling point for our profession. Just having that strong commitment. Obviously, we're, tend to be primary care schools because that's the people that we attract, and that's the type of education that we kind of lift up, and it's important to our profession. But we have students that match in all specialties, and having undergrads understand that's really important. But just really being committed to making sure our students have the best outcomes for themselves, no matter what their goals are. I think that's probably the way it is for your schools as well. I know we do a phenomenal job. I can't say enough about our GME process. But
where does that conversation start? Is that in year one or is that later? as
Pretty
it
much,
relates
it's
to-
earlier and earlier every year. We have someone completely dedicated to that. And they start in the first year having some exploratory, like we do careers in medicine, which I think is a really valuable tool that really hasn't reached its full potential yet with our students, but just helping them explore early on what their passions are. You come in with a narrow idea of what you want to do. Yeah, you told the admissions committee that you wanted to be primary care, but you may have another idea that you're thinking about. But just helping people vet out what is going to work for them and what's going to give them lifelong. I mean, it's one thing to be excited on a rotation and love it, but to think about whether you want to do it every single day and what's going to give you that balance. Sometimes you make choices out of what do I want my long-term career to look like? Yes, this is exciting. I love being in the OR every day, but is that where I want to be for the next 20 years? And helping students figure those things out in first and second year are really important, just to kind of give them flexibility, hopefully, in their mindset about what might bring them some joy, or what their gifts are, like what gifts. You know, I'm not good. I'm a family practice doctor, but I've reached out and about everything other than sitting in an office and seeing people every 15 minutes because that's not really fit my personality. I've done hospice and wound care and nursing home and things like that, where I'm a little more free flowing in my day. And figuring those things out early is really important to figure out what your opportunities are within each career path. Family medicine, obviously, I'm going to give a plug for that, gives you a lot of flexibility to do a lot of different things in a lot of different ways. And that's usually my plug for family medicine.
Excellent. Athena, I think we're at the top of the hour and you're about to depart, but thank you so much for joining us. It was a pleasure meeting you.
Leave anything left about DOs, it's that I noticed in our school too that we have a lot of different age groups and a lot of different backgrounds and a lot of different careers. I'm 26. I consider myself old. I know I am not old at all. I understand that. But, you know, I'm amongst people that are from the ranges of 21 all the way to in their 30s. There's somebody who has a PhD that decided to go back, a farm degree that came back. So that's one thing that I think is very special with DOs, because I seem to notice that a lot more in DO classes than MD classes. And I think that speaks volumes on us. So
Excellent. Thank you for those final thoughts.
thank you so much for
Take care.
having me.
Enjoy the rest of your evening. Thank you.
Thank you too.
Dr. Wagner, since this is supposed to be shared, is there any study strategies that you have noticed from your most successful students? Any things that they're doing or any preparation that you see that they have participated in that seem to really stand out to you?
I think that varies a lot with different parts of your medical education. Obviously, the first semester is like literally, like as they say, but it's so true, drinking from the fire hose. So much coming at you, and everybody comes at a different level of understanding of certain things. And we do have a BMS program, a master's program, and I do like sometimes those students really do have an edge. Not that I would delay medical school if I could help it. I think if students get in, they can find their path forward, but doing a master's prior to med school in higher level sciences is not a bad thing if it's something that either you fell into or you chose purposefully to get you ready for the level of volume of information. I think that just trying not to silo, which I still silo in my life every day. What's my next? I always think of spinning plates. Which plate's going to fall? I got to run to that plate. But you know, balls are bouncing. But to me, it's more like that plate. You got all your plates spinning, and one of them's going to fall, and you got to run to that. But I think it's really important to try to keep up with all of your topics and not just think of it as exam to exam to exam and the whole flow of things. I think that it's important to read. I can't get my students to read unless they have a quiz question out of the material that I'd like them to read. But I think seeking your own understanding, whether, you know, you can ask a question, but if you didn't try to figure it out yourself first, that's really not a good strategy. Because sometimes I'm going to the textbook and looking at that and figuring out how to explain it to you better, because I can't carry it all in my head anymore either. But I can understand it and explain it. But I also want students to try to figure things out, because that's what you're going to do in medicine every day. You're going to try to figure out patterns and what's going on and seek out information. So we're not really set up well in medical education for students to have the time to do that. But I think the more you could try to read material that's related to your bulleted PowerPoints to try to understand it better. That's really important. And when you go to the boards, you have these long stems to read. And I feel like sometimes students struggle with the timing of boards because they're not used to reading the paragraphs, which is crazy. If you read for pleasure, that'll help. But just, you know, because being able to just synthesize information and gather things out of it, I think that we're such a PowerPoint, Panopto, or whatever you're recording at your school is, the podcasts and things type of generation. It's really hard to read things. And I think the more you can force yourself to do a little bit of reading and seeking out secondary understanding is really important. And the boards, it's all about questions. It's about mastering those questions. You need to know the topic and the material. I do part of the board's coaching as well, but the most successful students do a ton of questions, and they really master being able to read those stems and pull the right information out to answer the questions and know how to strategize in a question and just be calm, like just being able to sit and take an exam that long and take it one question at a time without feeling overwhelmed. The more questions, the better. You need to do the content review 100%. You need to know the material, but you can't sacrifice that for not doing questions. And that's been pretty well proven. So yeah, it's a challenge to balance it all and figure out the right strategies to get it all in and keep up with all the different courses that don't overlap like they should. It'd be nice if everything intersected nicely, but sometimes it feels like one exam to the other, and you just have to sacrifice things to get through an exam, and that happens. But always trying to bring yourself back to the big picture of what you're trying to learn across all the courses.
For the little bit of researcher that I call myself, do you find any disparity between, with the reading issue, between students who attend more lectures versus those who don't? Because I noticed when I visited the COM that I visited, a course was not full, the class was not full. And so I asked that question, and they said, well, you know, attending lecture is not mandatory. You know, we get the notes and the PowerPoint and whatever. So have you noticed any disparity in how well students are doing based on their
I don't know if we've
lecture?
really vetted that out. I do have to admit, as much as I'd like students to be in lecture and engage, but I think it's because if we just lecture, then if I'm a student, I can listen to that just as easily as sometimes more effectively other places. So we're not really setting it up for engagement. I mean, I think the best thing, if you can make it work as an education, it's not always easy, is to be able to do flipped classroom, but the students have to do the work for that to work. And we've tried it a few times here and there. And I think that it just has to be a commitment of the school and the students if that's the curriculum. And it's a challenge because if students don't do the work, then it's not effective. But I do think that the students who aren't in the classroom, sometimes the reasons they tell me that and I've had some higher level students that will go to a study room in the school, watch it live, but they can also pause it and rewind it and take notes better, which is unfortunate because I really like the engagement. I don't like to be the lecturer who doesn't have students in there. So I think we have a lot of work in education to do across all different programs, not just medicine, about having to figure out adult learning and really apply those adult learning principles to higher education, because we're still, a lot of us just lecturing. And I think that the engagement and the critical thinking and stuff is really important. So I don't know so much that you could really gauge whether the ones that are in lecture versus that lecture, how they do, because I think it depends on the student and how they best get the information. But some people just don't have the attention span to take that information. But somebody at AACOM actually said, or not AACOM, at OMED actually said something that really resonated with me, is that in our Panopto, we do Panopto, but in our recorded lecture mentality that we have, we're not as good of listeners because we're not used to having to listen for content and listening to what people say. We're sometimes just listening and thinking we can rewind it, thinking we can speed it up or slow it down, and not in the moment. So I think that's something to think about with our recorded society and how we're not engaging in conversations and just listening and trying to memorize things. So
yeah, and I think it does have to do with the learner and where they are, because you'll know my age because I have to be on the front seat in the class looking at the professor. So
yeah,
that tells you how old I am, right?
I understand.
So
Amelia,
welcome, Amelia.
Hi,
So,
Amelia.
Hello.
we are just among some medical students, second year and third year medical students, and a faculty member. And of course, there's 3 of us from AACOM. Do you have any questions for any of our panelists?
I just got out of a lab, so I'm a little bit, flustered. Kind of just bouncing around here. I am definitely more interested in DO versus MD. I'm still planning on applying to both. I don't know if you guys like what schools you guys are from. I think I see NYT Com.
Mm-hmm.
Yeah. Sorry, I'm kind of like losing my train.
Yeah, most of them are from NYIT-Com, and we have one from Miriam University-Com.
Yeah, so the NYIT Com is definitely on my list. Maybe you guys could tell me a little about your student experience, what the curriculum is kind of like, how the mission plays out. Yeah, those kinds of things.
I think just going off of like what we were talking about lectures is NYIT-COM has like an asynchronous lecture program. So what they do is at the beginning of each block, they'll just give out all the lectures for the entire block. And then, which is good and bad in a way, right? So we're talking about how like being in person is helpful. So you can like meet with the professors and ask them questions and stuff. But also it gives you the flexibility to schedule your week in a way that gives you the most free time and gives you the most makes you the most effective. So like personally, I like to do my lectures in the morning and then review them in the evening. But like sometimes I know some of my friends will go up until like 3 a.m. studying. So whatever works is the best for them. And so I think specifically for NYT-COM, I think I personally like the asynchronous classes. But I don't know what everyone else is saying as well.
I think it also depends. We're from the New York campus. I don't know where you're located and what you're specifically interested in, but we have 2 campuses. We have one in Jonesboro, Arkansas, and Long Island in New York. And I think all 4 of us are from the Long Island campus. NYT-COM is it's a great school. We're all from, like the 4 of us are from there. It has a lot of good things about it. We actually have tours coming up on campus. So if you ever want to come visit, you can come and schedule and learn more about like in person, like how the school functions and stuff like that. I also love that we have asynchronous lectures because it teaches you responsibility and you get to plan out your own week and you have time to devote your stuff to extra time for extracurriculars, research. So there is that balance that you can get with asynchronous courses. We have lots of extracurriculars on campus and we have lots of resources to provide. Like if you're interested in starting your own club, you can do that on campus. Like we have the services for that. And if you're interested in doing research, we have many people like and many professors who are like, we're looking for someone. We have a lot of opportunity on campus. We also have a lot of volunteering opportunity. We have multiple clinics that we're associated with. So you could do telehealth clinic that we have online where we see patients this way, or we could see patients in our in-person clinics. We have 2 of them that we're affiliated with. And this just gives you a lot of practice in like your clinical skills while you're a student. So that's all I have to say.
Yeah, and just to add to the asynchronous, so the lectures are asynchronous, but we come in person for all of our labs. So like our OMM lab is in person, our doctor-patient relations lab is in person. We have in-person sessions every other week. We'll do like question sessions. We all have to like work together in a group, answer a question a professor will put on the board. And then if we all get it right, he'll just explain it to us and like go over it. And then if like a certain amount get it wrong, then we like break up into our lab groups and discuss it. And we also have like standardized patients. So this week, I think probably all 4 of us, like we were in our Institute of Clinical Competence. So we saw a patient with a cough and had to evaluate them. And it's like a gorgeous facility. And we also have like mannequin simulation events. So it's kind of more of like a emergency room trauma situation where you have a group and like the patient, something's happening with them. The one we had last time, I think they were having a heart attack and crashing, and we all had to like work together and figure out how to help this patient. And generally those things are like reinforcing like a specific concept. Like in the one we just had, it was don't give a nitrate to a patient who's hypovolemic, that kind of thing. So there's lots asynchronous, but also a lot of in-person opportunities as well.
Yeah, that's great. I was specifically looking for a school that has the asynchronous option. I'm also at Colgate University currently, so I would probably prefer the New York campus over the Arkansas one. I'm from Cleveland, Ohio originally, so also looking at a lot of the Ohio schools. But yeah, I guess, are any of you involved in research yet, or when do people kind of start doing that? Also, what is the grading system?
In terms of the research aspect in college, I was not a big research person, so I may not be the best person to talk about this, but I was even able to get onto a research project in pretty early on into first year. I think the anatomy department emailed a bunch of people in our first year class, and they were like, I think there were second years who proposed projects, and they were running projects, and they were like, we're looking for first year students if anyone's interested. And then I just emailed about the project I was interested in. And I found it interesting so far. I mean, I got to work with cadavers, which was really nice because we didn't get to do that our first year. I think it was due to COVID. Like now the first years this year are doing prosection, dissection, but we didn't have that opportunity besides just looking at the cadavers. So I really enjoyed that. I feel like it's fairly easy to get involved with a research project. Most of the people that I know who are interested in research are doing research. So there's definitely different aspects of it to it. Like I'm not one that's going to be starting a research project at this point in time, just because I don't know how to do that. And that's not something that I'm necessarily interested in, but I do enjoy what I'm doing so far, if that helps you in any way.
I could add on to the research aspect. So I did bench research in college, and thankfully I have publications because of that. But again, I didn't want to continue doing bench research in medical school. So I started my own research project, and I'm currently working on it. It doesn't have to happen within the first 2 years of medical school. Like research could be ongoing, and it doesn't always have to look the same. Like my research is in medical education specifically right now. So it doesn't necessarily have to be like about a specific topic. You just have to do what you're passionate about. You also, as a third year and fourth year, and I think that Paul can answer more to this, that if you have an interesting case and you get permission, you can write a case report, and that also counts as you're a part of, doing research and publications. So they have aspects to that. And to add to your other question, our school is pass-fail grading system. So our exams you have to get above a 70 in order to pass. We do have honors for the top 10% of the class, but we do have that, but majority and everything that we're graded on is pass-fail. So the most important thing is to pass, and that's what shows up on your transcript, a P.
Yeah, so I can also talk a little bit about the research. And you were saying that asynchronous is really important to you. And just before you got on here, we were actually talking about how most of the comms actually are asynchronous. So even at MUCOM, we are asynchronous as well. There is an option to come in person to classes, but you can also watch virtually. So that's kind of an interesting kind of piece of information to keep in mind. I would definitely encourage you to keep asking that question, since it sounds like that's really important to you. But as far as I know, most of the comps are asynchronous in one way or another. As far as research goes, I didn't do a lot of research in undergrad. I actually came in with no publications and research background, just because that wasn't an area that was very interesting to me outside of the clinical realm. And coming from kind of a hard science background in undergrad, I just didn't really have a whole lot of opportunity to do clinical research. And maybe that was also partially because I wasn't really seeking it out. But now that I'm in medical school, I've kind of found areas I'm really passionate about. So one area I'm really passionate about is osteopathic manipulative medicine. So in my third year, I took an elective rotation at a local hospital and did osteopathic manipulative research inpatient on cancer children, where I was actually the operator. I was the one doing the osteopathic manipulation as part of a larger study. So it was really interesting. I loved it. I got to have patient experience, got to practice my skills of osteopathic manipulation on a population I hadn't actually previously done work on. So that was really cool. And then I also did some more bench style research on CT scan analysis in a kind of a spinal dislocation in the cervical spine. So that was, and I actually did get a poster presentation on that one. So those were my two research opportunities. One thing to keep in mind is a lot of times when you rotate and at the school you choose, there are clinical affiliates. So at MUCOM, we don't necessarily have a hospital, but we have affiliated hospitals that kind of cater to our school, and we do a lot of rotations at. And I think most comps either have a hospital that they work with more or are affiliated with. And a lot of those hospitals will have residency programs. And it's a requirement in a lot of residency programs to have research on your back. So as some of the other students were saying, you'll have opportunity to do multiple research projects. And to be honest, I've turned down more than I've accepted, just because there are certain research projects that I'm really not interested in. It's just not up my alley, so to speak. I don't really find it interesting. I think it would be more difficult for me to find interest in it than it would to actually do the research, which is something to keep in mind too. Once you get to medical school, if you show interest in a specific specialty and you kind of talk to people in front of you, the opportunities, at least in my experience, kind of present themselves as you go. So just kind of be passionate about it. And also, if you're passionate about volunteering clinically, like that is a huge benefit to your CV and can really get you places depending on what specialty you're thinking of. So just kind of keep that in mind and kind of develop a story of the person you want to be. And if research is a part of that, opportunities will present themselves, and you'll kind of figure it out from there. But yeah, that's kind of my 2 cents on the topic. Sorry if I took too much time explaining that.
No, that was perfect. Thank you all for the answers to that. I guess my last question is, did any of you take a gap year, and what did you do during your gap year? I'm currently starting to think about what jobs I could be applying for. So any ideas would be great.
I did 3 gap years actually. And for 2 of them, I did clinical research, and for one of them I scribed. And honestly, like I can't recommend gap years enough. Like I think I learned so much just about myself and about medicine, and gained so many life skills like in that time that just let me come into medical school so much more like grounded and ready than I would have been if I had just gone like straight from undergrad, just like only ever knowing the school thing. I think it's good to go straight through too. Like you definitely are going to save yourself some years, but I took gap years and I love them and I don't regret it at all.
I took one gap year and I got my master's during that time. So I sort of stayed within the school environment, but it was asynchronous because of COVID. But I definitely agree with Allie. Like it was a nice, like it was a change of scene just going from college, and then COVID started and there was a lot of uncertainty about what's going on. So for me, that was like I needed a little bit of stability, but like looking back, I wouldn't have minded taking another gap year necessarily. Like I was not opposed to taking them, but it also depends on your circumstances and what you want to do. If you feel like you want to improve and take a gap year for research, that's one way, or to get clinical experience, that's another way. We have a lot of people in our school who took multiple gap years working in a clinic, getting some experience, doing research, or pursuing another type of career as well, because it's not only limited to that. So it just depends on your circumstance and what you're interested in.
Thank you. I'd like to welcome Melina, who came in shortly after Amelia, and Phoenix has joined us as another second-year student from NYIT AACOM. And so Melina, do you have any questions for the panel?
Not as of now, but I've been getting pretty good answers from some of the other people like me who have questions for the panel, and I've been liking it so far.
Excellent. If I could ask the students to date from, what would you say has been probably your most impactful experience, whether it's in medical school, whether it's been a particular case or a particular course, or if you could pinpoint it down to one, what would you say would be your most impactful experience to date? So
I can actually take this one. So it was actually kind of recent. I was on an internal medicine rotation. So for those students who don't know, when you are a third year medical student, generally you transition to clinical experience. So you're in clinic more instead of didactic where you're in classroom. So I'm in clinic. I was on an internal medicine floor, went back to talk to a patient who was unfortunately diagnosed with a condition that required hospice palliative care. And their life was expected to end within the next 6 months. So kind of a sad situation, and just kind of went back to talk to the patient and see how they were doing and really help them digest as much as I could what was going on with them. And the next day I went and rounded on the patient, and he had tears in his eyes. He grabbed my hand and he said it was because of that conversation with me that I was able to digest what was going on and make a definitive decision on how I am going to move forward in this process of hospice palliative care. And, you know, he was crying, I was crying, and it just meant a lot that I was able to kind of have that kind of humanistic experience and really help that gentleman in his process of care at that point in his life. So that was really impactful and just really showed me that, you know, medicine is more than just clinical knowledge. It really is a side of seeking out where the person's at and trying to connect with their most basic needs.
Thank you for sharing that. Anyone else?
As far as preclinical years goes, for me personally, our student government DEI committee, so like the Diversity, Equity, Inclusion Committee, hosted in February. They had a health equity workshop, which was, so it was like a 2-day long thing. It was after one of our exams. And so I really did sign up last minute. I was like, okay, cool. I have like nothing else to do. Let me just sign up and see. But it was great because I was able to like connect with other like-minded students, and even like the guest speakers that came in, and they talked about like how important it is to keep the humanity of medicine in it. And so it was a nice way to like take a step back from like all the studying and everything and just talk to people and talk about what we can do as even medical students to help make sure that like our future patients and the system that we're working in is supports the right people in the right ways.
I'm gonna add something to this. It's what Paul said before. Like whenever we have our standardized patients, we're graded like on our clinical skills, but we're also sort of assessed on like how we interact with the patient. And it's really nice to know that like while we're doing it and going through that certain patients are like, I felt super connected. We had a good rapport, and like it gives confidence that we're doing this for the right reason, that we're maintaining our empathy and still being involved and interactive with patients while applying our clinical skills.
Excellent. And welcome, Erin. And is it Yelizabetta? Beta?
Yes, you can call me Lisa. I know it's a long name.
Thank you. That would be helpful. And what school what comm are you from?
I'm from NYIT.
Okay. All right. Thank you. And I think just for the sake of time, we have a few people that need to rotate off. And so thank you, Dr. Wagner. Thank you, Asnat. Enjoy the rest of your day. I will be in touch with each of you. Any final thoughts for?
Yeah, before I leave, I wanted to circle back with Amelia about gap years and just my perspective as faculty and someone who's been heavily involved in admissions in the past. I'm not currently, but started our admissions program at Marion whenever we started the medical school. I think that the most important thing is just that there's some meaning to the time that you spend. I think there is, from my perspective of educating medical students full time about the past 6 years, is that our students who do come in a little later with more life experiences, I think have an easier time of things a lot of the time, just because of the maturity level. I mean, it's like a lot of maturity happens when you are kind of outside the educational system doing some other things. I mean, we're in bubbles, right? That's part of the hard part about medical school. You go straight from undergrad to medical school and you're just in this educational bubble. But doing things like a work experience or a research experience or clinical experiences are good. I also was talking earlier on the panel about how sometimes doing those master's programs can be very beneficial, just because you come in as a medical student really used to the volume and the high intensity level of the higher science classes. And I think that it has been a good path for a lot of my students. We have a BMS program that somewhat feeds in. There's still criteria that have to be met, but feeds into our school a little bit. And we get to know the students and they get to know us, and that's kind of nice. But we get people from other master's programs as well. And they just have had an ability to get the basics down. So that first year is a lot less challenging as far as keeping up with the volume and the complexity of the material. So I think there's a lot of merit to taking a little different path to med school. So it's great. And it helps you figure out if it's really what you want to do. I don't want to be the negative person about medicine, but there's a lot of challenges, and you really have to know that you want to do this, and you really have to know that the sacrifices and the time and understand what you're getting yourself into to be really present more in those 4 years and ready to tackle all the challenges that come. It can be a very wonderful thing, but it's really good to always vet out what you're doing in your life, and sometimes those extra years can be beneficial. So I think from an admissions standpoint, they can be looked at very favorably if you make some meaning to them and explain them well, and explain the growth process and what you gained from those years. I don't think it's usually looked at as a negative thing if it's a meaningful reason why you kind of took a little different path. So hope that's helpful. I do feel bad that I'm the only faculty person leaving, but I am so excited about these medical students and the answers they've had and the experiences they've shared. I think that's who really these students want to listen to anyway. But I appreciate the opportunity and happy to help. This was a fun experience, and glad to meet all the new AACOM people. Welcome to the profession, and good luck to the pre-meds. It really is a great thing that you're considering, and I really want you to continue to vet out your opportunities and options in medicine. So feel free to reach out to AACOM. They've got a lot of good resources, and good luck to all the medical students.
Thank you
Paul,
so
I'll
much,
see you
Dr.
around.
Wagner.
All right, thank you, guys.
Enjoy your program this evening.
I'm going to. I'm excited. So, all right, thank you. Bye.
All right. Take care. Any other final thoughts to those who are going to be leaving? And Amelia, just to kind of echo what Dr. Wagner had indicated, that's one of the messages that was reiterated at the admissions office panels at OMED, which was a conference that was held in Boston a few weeks ago. And as it relates to a gap year, they spoke highly of encouraging that and to utilize that time to kind of learn who you are, use some meaningful engagement, use that time for some meaningful engagement, which could help your application process.
I'm not sure when the gap year question was asked, but I also took a gap year. And if you want to stick around, if I'm keeping you, tell me. But I took a gap year and I worked as an ENT. And I thought that was a wonderful experience. So if there is obviously that courses like that and certifications like that take time and they take money. So obviously if it's going to displace you, don't pursue anything like that, but don't be scared to get involved with something clinically, because experiencing patient care, obviously not even close to the kind of patient care you'll have as a physician, but being one-on-one with people, being in, critical thinking and decision-making situations, whether that be a scribe, ER tech, CNA, EMC, the list could go on. I thought as coming in as a medical student, those were great foundational, I got a lot of great foundational skills prior to coming to medical school. You build rapport really easily, you connect with your peers a lot easily. But yeah, so overall, don't be scared to jump into something clinical if you have the time and you have the ability during a gap year.
Yeah,
And medical students, I just have to say, the joy and exuberance by which you are articulating your thoughts is so encouraging, and I think speak a lot to the profession, right? Because the care really resonates through your comments. So thank you for that. I'm sorry, Amelia, I think I was cutting you off.
No, it's fine. I was just saying thank you. I guess something else I'm thinking about is I studied abroad in Copenhagen, and I'm wondering how I could possibly, integrate that into my application, leverage that to show that I've had diverse experiences and things like that.
I'll jump in again if that's okay. I think the best way to incorporate that is possibly talk about, why an experience in a different country would be relevant to your U.S. medical education, right? Maybe you were experiencing a different healthcare system. Maybe it showed you, maybe you happen to see a different patient population out there in that experience, kind of thing like that. So I would say draw on how that experience with a healthcare, focus, and include it in your application that way. Because I mean, and also kind of points to you being well-rounded, right? You've seen the world. Like Dr. Wagner said, we sometimes are in a bubble because we're in this academic circle, right? So if you can really hit on what makes you not in a bubble, that'd be awesome. And I'm sure it'd be really great to read from an admissions side, it'd be unique to see.
Yeah, so bouncing off of that, I believe Osnat mentioned how we have the standardized patients before. And in the beginning of first year, they put a big emphasis on being empathetic and being able to talk to a patient. So when you're in there, when you're describing physical exams and everything like that and talking to the patient, they don't want to hear medical terminology. They want to know that you're also a human being and know how to talk to someone in layman's terms. And I think an experience like that really speaks to who you are as a person, because they want to hear that you have interests outside of just medicine and that there's other things that you're passionate about in life, because at the end of the day, you're going to have to be a person talking to a patient, not just a medical professional, just talking in medical jargon. So they really value seeing that you're able to connect with people and converse with people without just being closed-minded. And also to add, I just want to add,
Go for it.
I also took a gap year too, and I knew coming from college that I was going to take at least one gap year, but mine was during COVID, so that was a little bit difficult to do anything, and I had to take the MCAT during that, but I just knew I needed that time to let my brain relax a little bit from studying, because I knew that going into medical school is going to be a big adjustment, and that college isn't easy either, so it's definitely very valuable. I did work in a podiatrist's office scribing. I didn't really enjoy it that much. It was the only thing I was able to get at the time just due to the circumstances, but now it does help with having to write SOAP notes up after patient encounters. So I guess I did get some value from that.
I just wanted to add with what Ava said about like the studying abroad. I also studied abroad in Italy, and it was one of my 15 experiences on my application. And it's something that interviewers really like to see, because it was something that wasn't medicine related, and it really made me a person in their eyes. It really helped them like see like, oh, she's more than just medicine and academics, she's like a real person. And that's something that advisors really, really stress. So even if you don't have an experience like studying abroad, you should add at least like one hobby or something to your application, because it really stands out from the rest.
So why did you all choose osteopathic medicine?
I can start for this one. So for me, some of my early experiences, I was able to get a shadowing opportunity with an orthopedic surgeon, and he wound up being a DO from NYT, which is where I'm at. So he kind of introduced me to it, and I never heard of it before, and I was like, oh, that's kind of cool, like, the mind, body, spirit idea. And then another doctor who I was also close with also went here. So like both of my like experiences early on were with DOs, and I was like, these are really great physicians. They're empathetic. They have great connections with their patients. So they just kind of introduced me to it. And then when I got into like the same school they went to, I was like, well, I guess that's where I'm going.
Thank you. Anyone else?
So for myself, I'm from Long Island. I live in Oyster Bay, so I'm like 10 minutes away from NYT. And I always knew it was right here, but I grew up, my pediatrician went to NYT, and I didn't know that. And I didn't know he was a DO until I realized that there was a difference between an MD and DOs. And my primary care physician also went to NYT. And I feel like a lot of the DOs that are on Long Island went to NYT, but I always knew that I wanted to apply to both MD and DO, not to limit myself to one over the other. And it just so happened that I got into NYT and that it was right here. But I do value how, based on the physicians that I've had in my life, that had a big impact on just my healthcare. Because, you go to a pediatrician, that's the only doctor you really see. And then as you get older, you have other physicians. But I also really valued the relationship that I had with my primary care physician. He's not here anymore, but I just really liked how they spent time talking to me and had a lot of, like, you can see their personality, whereas I've been to other MDs, not to talk badly about MDs, but I just really valued the relationship that I had. And I'm very happy that I'm at a DO school.
Excellent. Anyone else?
So for me, I have a bit of a background with some family members who are MDs. And so I had kind of seen how that looked. And I think I felt like when I had rotated and shadowed some DOs, I really appreciated kind of their perspective. Same thing that everyone else has been saying, just kind of like mind, body, and spirit. I got to actually get treated with osteopathic manipulation by one of the people I shadowed during her lunch hour. And I just really appreciated that. I had some back pain when I walked in the office. When I walked out of the office, I didn't have back pain. So, free treatment. And I also learned what osteopathic manipulation was in that moment. So that just really kind of lit the passion for me to, I did apply MDDO, but I actually, by the time I was getting ready to accept offers, kind of decided that I was really only going DO by the time I started to get offers. So it kind of aligns with, I think, who you connect with and the style of academics you want to get. I think DOs tend to be more community-centered physicians, regardless of specialty. You can definitely have very academic DOs, but that's just a general trend. And so it's good to kind of keep that in mind. We've been talking a lot about the benefits of community education, and that's something I have personally loved. So definitely have appreciated my decision to go DO.
Thank you. Anyone else?
I'll go next. My experience is very similar to what's already been said. My primary care physician, unbeknownst to me until probably around like my junior year of college, I found out she was DO, and she actually, most of her office was also DOs that I did not even know, which was great. And then, but being that I discovered that way down the road and I was like mid, application process, MCAT studying, et cetera, all the aspects in my, 18 years of being a patient with them, all of those positive things that I experienced, I knew that I wanted to pursue an education that would give me those kind of skills to my patients. So generally, same thing, seeing how much of a community-centered, person outside of symptoms kind of centered physician that DOs are, and that was really great.
Lisa?
Sure. I had a similar experience to basically everyone here. My mentor for basically since high school, he went here. He was an orthopedic surgeon and he always just spoke so greatly about choosing DO and about the school in general. One thing that I really like is it just gives an alternative to treatment besides just medication. It's something that's instant and it's just something that helps people feel better. And that's always great.
Thank you. Amelia, you are surrounded by some brilliant folks. So you have their ear. Ask anything.
Yeah, I guess I don't have anything else specific. I'm pretty convinced that I want to do DO. I'm still going to apply to both, as a safety, but I've done athletic training for almost 8 years, as a student. So that initial pain relief is really attractive to me. And I'm currently shadowing a DO in a very rural community. I don't know if I said I'm at Colgate. So, it's just farmland out here. And I can see how essential she is to the community. I guess, do you have any pieces of advice for me? I'm currently working on my applications, researching schools, that kind of stuff. So if you have any last words, I'm all ears.
Just curious. Oh, I'm sorry.
Go ahead.
Are you a senior?
Yeah.
Okay. I think my only advice would be is in my situation, I didn't want to limit myself in any way. And I didn't want to do anything that I would regret not doing. I wanted to apply to both and I wasn't sure just due to the circumstances with the MCAT and everything. But if there's something that you feel like you should be doing, and if you're capable of doing it, then go for it, because you don't want to regret anything throughout the application process, no matter what it is. If there's something that's your heart's telling you should do, then do it.
I think as you think about the application process, just kind of reflect on who you are as a person and where you want to see yourself going. ultimately, it sounds like you have some great experiences behind you. You know, even your experience for 8 years in athletic training, you already know what physical manipulation looks like, maybe in a different career, but that's a huge benefit, especially when you're looking at DO schools. So just as you kind of think through things, the Europe experience you talked about, like just kind of try to think through like, how can that fit into your narrative? And then how can you move forward with your passions and what would be a future step in your narrative if you end up taking a gap year or two? And I don't think you'll go wrong with that. Honestly, I think that it sounds like you've got a really strong application, and if you just kind of keep your passions and your doors open, you'll be in a good spot.
That's very relieving to hear.
And I believe Dr.
something-
Cameron
oh,
had
sorry.
her hand up. Dr. Cameron.
I was just gonna say, Amelia, it sounds like, and I'm gonna piggyback on Paul, sounds like you've had some wonderful experiences, and it sounds like you enjoy what you're doing and you're passionate about it. And so express that in your application, you know, don't hold back. I think there's a difference in bragging on yourself and being arrogant. You want to tell your story. You want people to get to learn you on paper so that they will bring you to campus and you'll have a tour and an interview and all of that. So just make sure that you share what you've done, why you're passionate about it, how important it is to you as you see your future progressing in medicine. And I think you'll be fine.
And how those experiences have taught you things about yourself.
Absolutely.
How you growed and matured through those experiences, I think will resonate a lot with the interviewers. And I'm sorry, Phoenix, I think you were going to comment.
Oh, yeah. I was just going to say, as someone, you know, like I said, I took a gap year. Remember, after this application process is over, be kind to yourself. You worked hard to get here to this application point. Take time to spend time with family, spend time with friends. For me, myself, NYTCOM was my first choice, but this is still 6 and some change hours away from my hometown. So obviously, living here, it's just like moving to college. You know, it's going to be a transition. So enjoy your gap year. Do, you know, whatever clinical experience you'd like, but also make time to enjoy life, you know, because medical school is a long road. It's a wonderfully fulfilling road, but make time for yourself in these gap years after you get all these applications in. That's all.
And Amelia, you've already registered with Choose DO, correct?
Yes, December 7th.
Perfect. Okay, perfect.
December 7th is the Career Eco webinar, but you're registered on Choose DO Explorer. So you get regular emails from us, correct?
Yeah, I got one today.
Okay, very good.
Anything else someone wants to share or anybody wants to share? This has been such an enlightening conversation. I've learned so much more. I just love talking to students about their experiences. So I'm just overjoyed.
Definitely be kind to yourself and be proud of yourself, because it takes a lot to get to this point, and then to apply and go through the whole thing and write up the whole application and get all your transcripts and scores and everything together. It's exhausting and no one gets it. So just be kind to yourself.
Yeah. And at the end of the day, just know like you're going to wind up where you're meant to be. Like whatever school you're going to go to is where you belong, and you're going to learn and you're going to have a great career. So don't sweat the small stuff too much.
Yeah, and once you hit submit on that application, it's out of your control. So whatever happens until then, you get an email and you deal with it when you get an email from anybody. Like there's nothing else you can do. You did everything you could up until that point. And that's another thing that kind of, once I hit submit, I was like, you know what, whatever happens, I can't control it. So do what you want in that time period.
Well, thank you so much. That's all great advice. I think I'm gonna go eat some dinner. I had like a 5-hour lab today, so I'm just dead right now. But yeah, it was really motivating, and I'm definitely gonna type up some notes about NYTCOM. Yeah, thank you guys so much.
Thank you for your
joining us.
participation.
Good luck.
Thank you. Good luck.
Yes,
And we'll
luck.
see you
Thank you.
December 7th.
Yes, good luck to you.
Rigorous. So it's not like this at every school. Some schools have hour limits on how much you can be in clinic. Not all schools do. Marion is a school that doesn't have specific hour limits, just that we are required to have 1 day off. So I am in clinic as much as the intern. So 12 hours a day is when I'm at the hospital. And then I'll usually be in about 1 surgery a day. And then last week I was on trauma as well, which meant that I was following a trauma team, which was a 5th year senior level resident, and then attending, and then me. And so in all of that, I'm doing 12-hour shifts. And then at least once during the month, I need to take a call night after the 12-hour shift, which basically means I'm in the hospital. I'm working trauma, I'm working general surgery, and I'm also in and out of the OR for various cases. So last night, admittedly, it was a little bit more of a low-key night compared to that specific facility I was at, but it still involved, a late night 5-hour surgery, a few consults on other floors, and just kind of learning about patients in a little bit different environment. I would say that the hospital environment changes pretty dramatically. I don't know if it's like that at all facilities, but after about 6 p.m., the shift change happens and the patients, personalities can change a little bit. We talk about elderly people having a condition called sundowning. And some of that does happen. You can definitely kind of palpate it when you walk in the room. I don't know if that's the right word, but you can feel it. The patients are a little bit more confused and a little bit different personality comes out. So it is a unique opportunity to kind of see some of the patients on the floor. And then obviously most traumas are going to happen after 5 p.m. because people aren't working at that point. So yeah.
Can you talk a little bit about, any of you, talk a little bit about the difference between what happens in year 1, year 2, year 3? What kind of continues and what kind of changes between those years in med school?
I could take this one as well. So generally, at least at MUCOM, you guys at NYT might have a little bit different situation, but at Marion, we start out with kind of a basic science overview for the first semester, so for the first 4 months. And then you jump into system classes in the second semester of first year, so that would be spring. And the first system class is CPR, so in-depth review of cardio, pulmonary, renal. And then second year is the rest of the systems classes. So at Marion, that is musculoskeletal and tegumentary and derm, GI, neuro, and then reproductive and psychiatry. And so you kind of get a deep dive into all of that clinical knowledge. And then mixed in throughout that entire time is a series of 4 levels of classes of osteopathic manipulation and clinical experience, where you kind of learn how to be a doctor in front of people instead of just maybe a researcher and didactic professional. So that's at least how Marion works. I don't know if NYT does it a little differently. And then third year, you jump into clinic. You're doing rotations where you're getting a deep dive into every specialty for about a month at a time, maybe 2 months at a time. And then fourth year, you start doing auditions, applications, and electives where you kind of start catering the tail end of your education to what you hope to do or what information you want to learn before you jump into your specialization so that you are a well-rounded individual.
Excellent, thank you. Anyone else?
Yeah, I would say NYT is pretty similar. The fall of your first year is called Foundations of Osteopathic Medicine. It's the name of the course. So you kind of are, all the foundations are laid for that systems-based learning, just like Paul was saying. I believe for us, we started in the spring of, so foundations in the fall of your first year, and in the spring of your first year, you start off with neuro. So one of the hardest ones right in the beginning, which is fun. And then I believe we did MSK, and then hematology, oncology, and then I can't remember what we did in the spring. And then same thing, it picks up just like Paul said, we did cardio, pulm, and renal, and are still in cardio, pulm, renal right now. So lay the groundwork and then start kind of essentially get the normals right before you jump into all the pathology. And then same thing, third year, you jump into clinic.
So I actually have a question for you guys at NYT. When you guys start with neuro, because this is something I've been curious about, when you start with neuro, do you feel like you have enough baseline information from that first semester to really kind of thrive when you get into that class? Because one of the things, Marian starts with CPR because they say that it's the foundation of the rest of medicine. So that's where they see the foundation at. And I personally sometimes wonder if neuro could actually fit into the first semester. That's something that I've wondered. And I'm just curious, how do you guys feel throughout your academics so far? Does that fit in pretty well?
I would say I enjoyed doing it first, the first system of the systems-based coursework, because then I kind of think of it as that is the baseline. It's not like, you know what I mean? Like everything in the body comes back to some sort of signal. You know, something has to say, hey, do that, you know, whether it be right now, we just talked about like respiration, you know, or respiratory physiology, renal physiology, all of those signals, you know, come from, you know, the main hard drive. So I like having neuro first as a baseline. Obviously, at this point, that was January of last year. So it's not, before we start board studying, it's not as fresh as it was. But I would say yes, if that's what you're, long answer to your question. I thought it was useful to have neuro first. I don't know how you guys feel. But I also am interested in neurology, so maybe I'm biased, but.
Yeah, I also agree. I mean, I'm interested in neuro too, so I just liked it in general. But we also did it like hand in hand with like the neuroanatomy, like right after winter break. But I feel like regardless of like what we started with, like I feel like we're always trying to make that connection in our head. So like maybe if we didn't start with neuro and we did start with like the CPR stuff, you know, we'd be finding ways to connect it back. But I do think like knowing some of the like sympathetic, parasympathetic levels are like helpful for some like the controls we're learning now. So yeah, I liked it.
Yeah, absolutely. I'm just curious. I think one of the downsides of having CPR first, at least in my career, when I hit boards, it became kind of difficult to bring back some of the CPR concepts, and they are core to boards. So you guys might be a little bit of an advantage there having that so close.
Anyone else?
I can agree with them. I liked that we did it right after winter break too, because it was nice to have a break for 3 weeks and then we had a fresh brain and then dove right into neuro. And it was a lot, I won't lie. But I like that we got the harder stuff done earlier on in the semester. Not that I'm saying the rest of the semester was easy, because it wasn't, but it was nice to know that we got that over that big hurdle in the start of systems, because it was our first system.
For those who may not have a real knowledge of osteopathic medicine, how would you describe it to someone who, you know, is interested in medicine but has never heard of osteopathic medicine? How would you describe that to someone?
You learned medicine in its entirety, just as many of the MDs do, but you have a focus more on the person as a whole in their entirety. And you also have a few more tools in your toolbox as to how to treat conditions outside of just the traditional side of medicine.
The biggest thing.
Oh, sorry. Go ahead.
Sorry. The biggest thing I heard when I was applying is that osteopathic medicine is you're treating the person and not just a set of symptoms. And that's a big reason why I chose DO as well, is it's so much more personal and individualized for every patient. And that's a big distinction from MDs. Because I feel like sometimes they're really focused on just like seeing as many patients as they can and trying to just like see the symptoms. Oh, okay, I can relate it to this. And whereas DOs are more just like, okay, let's slow things down a bit. Let's actually like talk with the patient, get their history, get more of their story, and that helps relate their treatment. And that's why a lot of people choose more DOs as their physician.
Yeah, I agree. Piggybacking on what Paul said about having another tool in your toolkit, I think again didn't know about DO until kind of farther into my academic career, but knowing that you have another tool as an adjunct to the rest of modern medicine, I think is really advantageous, especially for really chronic conditions, which are going to be your bread and butter patients. You know, all of us here, all these medical students here, how many people with COPD are we going to see in our medical career? You know, a lot. How many people with back pain, low back pain from their job are you going to see, you know, in your job across, you know, all of your years? So I think having that ability to treat all of those kind of things and have them, like you said earlier, also Paul, leave the office feeling better. I just think that's really attractive when it comes to your day-to-day job and the kind of fulfillment you get from your patient interaction.
Thank you. Excellent.
I just want to add, I really like how they started, we started OMM the first week. So we got used to putting our hands on other people right away. So it's not weird for us to be doing that at all. Like, especially, I mean, we work with each other most of the time, but when we do have to be with the standardized patients, and then eventually when we move on to third year, it's not going to be an awkward thing or uncomfortable for us to be putting our hands on other people in a respectful way, because we've been doing it since day one, and we have to do it multiple times a week, every single week. And I really appreciate that, because that was one of the things that I was really nervous about going into it, you know, not just taking tests on paper, but actually have to physically be doing things in person and speaking in front of people. We have to perform in front of doctors on a daily basis. So it's just something that we've gotten really accustomed to and used to.
Wow, that's excellent.
That is so true, Ava. So true.
Yeah, I mean, hopefully next year I'll see how I do, but I'm sure it'll be fine. Nervous, but it'll be fine.
Osteopathic medicine seems to be that, you know, that hidden gem. You know, one in four doctors are DO. And I wonder, and you all may not have the answer to this, but I wonder why it's not more, you know, widely known. Do you all have any thoughts about why osteopathic medicine is not as widely known as allopathic medicine? Do you think it's just because the lower amount of schools, or people just lump everybody together without knowing? Because a lot of you said that your pediatricians and all were DOs and you didn't know. Was it just because when we think of doctors, we think MD because that's what we think? How do we change that?
I think there's a little bit longer history to the MD side of being a physician. You know, AT was still around at the turn of the century. So I think that there is a bit longer history. And I think also just traditionally, I think this is starting to shift to be much more equal. But I think traditionally, a lot of the research that came out of medicine generally came from a lot of the MD schools. And I think that there's some history behind that in the last half century or so that started to change. But a lot of the major funded schools were more MD back in the early 1900s. And so I think some of it's just a carryover from some history, but I really think that's changing. There's a lot of great research coming out of many specialists and many medical schools and medical students who are DOs as well.
Thank you. And Gabby has joined us. Welcome, Gabby. Are you a registrant or are you a medical student?
I'm registered.
Okay, so we are here. I'm from AACOM. Dr. Cameron is from AACOM. These other illustrious panelists are medical students, second year and third year. Do you have any particular questions for them?
Yes. So my main one is I got out of the, how do you pronounce it again? Not naturopathic? Yes. And what do you guys see the main difference between that and this is? Because they sound kind of similar.
So you're referring to like the homeopathic physicians, right? Or naturopathic, like
Yeah.
it's not NP because that stands for nurse practitioner, but I think I know what you're referring to.
Yeah.
Yeah. So I don't have a ton of knowledge about that degree or what like educational, road that is, but osteopathy is the exact same that you get with an allopathic or MD education. So all of modern medicine, all of physiology, all of anatomy, all of the clinical skills, but in addition to something that's called osteopathic manipulative treatment, which is a kind of body-centric, joint musculoskeletal-centric treatment format that you could use in addition to pharmacological or any other modern treatment. I feel like I don't want to speak poorly of like naturopathy, but to my knowledge, does not have as much research. Maybe I'll just say it like that. Does not have research backing to the profession. If anyone wants to jump in, who knows more stuff about it. But in sum, what you're going to get with a DO degree is exactly what you're going to get with any other physician, any MD physician degree.
I can jump in here a little bit. So I've actually shadowed a osteopathic doctor who does homeopathic medicine. So it is an option to kind of get some further training, whether it's through a fellowship, or I think more traditionally, a lot of people will do it through some extra classes. But a lot of the difference really does come down to, like Phoenix was saying, maybe a little bit of the research mindset. One of the great advantages you have when you get a DO education is you do learn all about the metabolism and some of the concrete knowledge that we know about the human body that, the MDs fully appreciate as well. And so if you choose to kind of focus on homeopathic medicine with an osteopathic background, you can kind of come at it with a foundational knowledge of the metabolic system in its entirety. So that might be a little bit of a benefit. I don't know much about the homeopathic by itself doctorate track. So I really can't speak to if they get that background, but that is a background you can go into a lot of depth on as a medical student.
Okay. And just next question, I guess. What made you guys choose this over the regular MD path?
That is a question that we have actually talked about quite a bit. So I think that's why there's some silence here. I'll speak for myself personally. I have some family members who are MDs, and I decided to go DO just because of some shadowing experience I had. And I had been treated by one of the people I had shadowed and really appreciated her outlook on medicine and just seeking to see the person as kind of the mind, body, and spirit instead of just the clinical disease that was presenting in front of her, but the actual person in his or her entirety. And I saw a great benefit to that. And then the osteopathic manipulation really helped me out. And she actually just demonstrated it on me once.
Yeah, so going off what Paul said, just like some of my early clinical experiences were with DOs. I shadowed an orthopedic surgeon, and then some of my own doctors were DOs that kind of introduced me to the whole kind of osteopathic education. And it was something that really interests me and kind of connected with me. So the more I looked into it, the more I was interested. And then when I wound up getting into, NYIT, it was just like the right fit.
Very cool. Thank you guys for your insight.
So Gabby, okay, I was going to ask her where was she as part of her process, but okay. We'll pause shortly again. So do any of you have any recommendations on how best to prepare for the MCAT? Emotionally, academically, spiritually, whatever.
I can go first. That one, if that's okay. So the two best things that looking back were the most helpful was I scheduled mine to be really close to biochem and physics. which are two subjects that I personally struggled with. So I did it, finished that up in the spring and then ended up taking my MCAT. I think it was early, maybe first, second weekend of June. And I thought that was really nice because the really hard material was fresh in my mind. So I could kind of capitalize on the studying time for the other material that might have been, like bio from my freshman year and things like that. The second thing I would recommend is if you can replicate the testing environment as much as you can. That will help you emotionally, that will help you academically, I think. So if you can find, even if you're sitting in a public library and you're taking that full length test in a quiet space, taking those breaks only when, the practice test a lot too, and replicating the environment as much as you can is relieve so much stress on test day. And then, third thing, drive to your testing site if it's nearby you. The day, like I did that like 2 to 3 days before, figured out where I had to park, figured out, all the other things that could promote stress the next morning. And that just alleviated a lot of stress. So that's what I would say.
Thank you. Anyone else?
I would say like the biggest thing is like having a schedule and sticking to it. And within that, like giving yourself like the necessary breaks. Like it's impossible to study all day, every day. There's always more to do. But then when you're giving yourself that off time, like fully allow yourself to enjoy it and like decompress. Because there's always more to do. You're not going to know all the information. And then with that, like, I mean, I had scheduled mine pretty early. And then realized like, oh, like I have to push it back, and like didn't really want to, but it's okay to make adjustments throughout your studying schedule. It happens, and I still wound up in medical school even though I pushed it back a little bit. So
a big thing for me is that you're going to be so overwhelmed with the amount of resources that everyone offers you. Everyone has a different tactic, everyone has a different study tip. So it's really important to find what will help you succeed very early on instead of just trying to do everything, because it's impossible. And I think Erin touched on this a little bit, but it's also very important to take like time off for yourself. So Sunday would be like a decompression day for me personally, where I needed that time, or else I would have just burnt out and it wouldn't have gone well for anyone. So that's very important. Take time for yourself. Don't compare yourself to other people. If everyone else is doing a billion things, you don't have to. Just find what works for you and just create a space for yourself where you can succeed.
That's so helpful. Thank you.
Really great point on the resource overload. 100%. I definitely agree.
And as we're coming down to the last 10 minutes of this session, this time together, do you all have any final thoughts, recommendations, comments for anyone out there in pre-med land about anything? Any final thoughts? The floor is yours.
It's going to sound very weird, but as you're going through this process, remember to be a little selfish. You have accomplished so much. Sell yourself on that application. I think Mrs. Cameron touched on this with a student. You have great experiences to share. Be selfish. Obviously, don't sound exuberant on your application like you're the best, of course. But I guess have faith in what you've done so far, and have faith in like where you are in this process. And then also being selfish in another way is when you're choosing medical school, think about where you want to go. Obviously, I guess choosing and applying. Look at the locations you like. Look at the locations of like what kind of patient population you might have. Look at the community at the school. Look at the faculty. If you have to have the chance to tour, I couldn't tour because of COVID, but even in Zoom sessions, I could see the culture, from the faculty and the students I was talking to. So I guess be selfish and pick where you are going to succeed, where you can see yourself thriving, not even just succeeding, but actually thriving at that institution. That's what I would say.
Thank you.
Building off of what Phoenix said, I think a big mindset when we're in the application process and interview process is to just pick whatever school accepts us, because it's just so competitive. But you really have to consider other factors about where you're going to be happy, because med school is such an overwhelming, daunting experience that you really have to find a school that's going to make you the happiest. And other sources of advice I would give is to take time off before you start school, because like I said, it will be hard and you really just need to decompress. You really need whether it's a gap year or taking the summer off, like yes, do your clinical experiences, do your volunteering, do your research, but just make sure to make time for yourself. And at the end of the day, I think someone said this earlier, but you're going to end up where you are meant to end up. So don't put that much stress on yourself. One way or another, you're going to make it, whether it's as a doctor or as whatever else, whatever is meant to be will be. So don't put that much stress on yourself.
Erin, do you have any final thoughts that you would like to share?
Yeah, so I was gonna say, like the work-life balance kind of aspect of it all. We're going into demanding careers, the education's demanding, it's a busy schedule, the application process is stressful. So I think for any prospective student applying is like finding a balance that works for you like now, and then being able to build off that like the rest of your career. So, what do you need to keep you like both feet on the ground and stable? And I think that'll really help, not only through the application process, but then when you get to medical school, for me, I'm like, okay, like, I know like I'm my best self, like when I can get up, go to the gym and then start my day with a clear mind. And that works for me and something I'm going to continue to do to keep me going.
Excellent. Well, thank you all for your time and your energy and your passion, and your choice to spend some time with us this evening. I am going to give you a few minutes of your evening back, and